Thank you for joining us for this series on navigating the transformation of the quality measurement landscape. I would like to thank our panel that participated throughout this series. It was a great pleasure to work together as a team on this series. And as one sees in the eyes of our team, that passion is apparent. We had two goals for this series, and one was really to inform the general public on the digital measure transformation from the old to the new landscape coming in 2025. And second was to expand our portfolio of consulting engagements to support your organization on what one really needs to know, how to evolve, and how to build your roadmap to that CMS mission. And that CMS mission is to use impactful quality measures to improve health outcomes and deliver value by empowering patients to make informed decisions while reducing burden to clinicians. And KHS adds to that mission of having a more effective, efficient, and less costly measure reporting framework. We're all in this together, and we must accomplish this by 2025 with Meaningful Measures 2.0. The approach we take begins with a template that looks like this, and it's adjusted to your organizational needs and goals. The transition is in steps and the stages that come with it with evaluation, so plan, do, check, act along the way. And based on our past engagements, you will have our promise that you will come out better informed and prepared for the future. We have developed a comprehensive measure catalog and roadmap by state and line of business, so we know when and how they will go digital in those different areas, and we know the operating models for implementation. We have started digital measure transformation using measure authoring tools like Bonnie. And we don't just read the literature, technical specs, and policies and regurgitate that. We roll up our sleeves and we'll get our hands dirty. So why engage KHS now? Well, with measurement year 2020 and 2021 specs being available, we suggest getting them knocked out so that you're ready to hand off to your operations staff in the near future. There is enough certainty that NTQA, CMS, and others are on the fast track to that 2025 date, with either no more medical record review being allowed or having completely digital measures. 2025, it's really like next week if you think about it, and you don't want the train to leave the station without you or continue with this highly burdensome, slow, and costly current framework. It's also not about just remaining compliant to those requirements. It's about mitigating fire drills, and the time is now. So take advantage of the operational and financial benefits of adapting strategically. Stay ahead of the changes. Don't be lagging behind. And implementation timelines will require years for stakeholders to build that infrastructure, hire the appropriate technical architects, and work with your partners in building those data connections. The first step in an engagement is assessment by KHS, looking at clinical data usage, measurement processes that you have, the departments that are involved, vendors that you use, any software validation or audit procedures. And also, it's going to be dependent on what are your different market requirements that you have in reporting. The second step is working with KHS and planning your roadmap to 2025. We will help with program planning, which will help you understand what that future state will be, how you get there, and how much it'll cost, and then also implementation planning. And that's really understanding what are those steps, when will it be done, how we will know if it worked, and getting you to the next step in step 3, and that's finally implementation. The CMS 2025 deadline is fast approaching, and even if it doesn't follow 100% as planned, the transformation has been committed to. And the likelihood of this transformation not going through and being slim to none, well, as we say, slim has left the building. And then going back to my days at NCQA and being the HEDIS policy director, I've always hoped that hybrid medical record reviews would go away. We all recognize this should be, and with the industry efforts of the framework, standards, and policies over the past 5 to 10 years, the digital measure landscape light is fast approaching and visible at that end of that tunnel. The approach we take begins with this template and is adjusted to your organizational needs and goals. The transition happens in steps and stages and with evaluation along the way. And based on our past engagements, you will have our promise you'll come out better informed and prepared for the future. We've developed a comprehensive measure catalog and roadmap by state and line of business. We know when and how they will go digital. We know the operating models for implementation, and we've also started digital measure transformation using Bonnie and measure authoring tools. We don't just read the literature, technical specs, and policies and regurgitate those in our consulting engagements. We will get you there. And thank you once again for watching this video and watching the video series. You can catch the entire series on YouTube, so please follow us there. And then also follow us on LinkedIn for updates from Kaiser Healthcare Solutions on this and other things that we are working on. And contact us for a 30-minute call so that you can learn more on what an engagement looks like for your organization, regardless of your stakeholder type. We work with health plans, providers, vendors, regulators, and measure developers and measure stewards. Thank you once again, and have a great day.